All right, let's dive into this chapter you sent us all about kidneys and, well, everything below the belt. It's a pretty dense medical textbook chapter.
Yeah, but it's a fascinating area, really vital stuff.
For sure. So we'll break it all down, make it clear and interesting for everyone. We're going to cover it all. Acute kidney injury, chronic kidney disease, those dreaded kidney stones, and all sorts of other urological conditions. You'll be an expert on this crucial part of your health by the time we're done. Ready to jump in?
Absolutely, let's dive in.
Okay, so the chapter starts off with acute kidney injury, or AKI. I remember it used to be called acute renal failure, didn't it?
It did. The name changed to better reflect the condition, really. AKI is not just one thing, it's a whole range of kidney dysfunction, from mild impairment all the way to, yeah, complete kidney failure. And to help navigate that spectrum, doctors use a few different classification systems.
The textbook mentions Rifle, Akin, and KDIGO. Why so many? They all seem to use serum creatinine and urine output to figure out how severe it is.
Each system has its own pluses and minuses, I guess you could say, and focuses on slightly different things. Take the Rifle E criteria, for example. It stands for risk, injury, failure, loss, and end-stage kidney disease. It's used to help understand how AKI might progress.
Oh, so like a roadmap for how kidney function could decline.
Exactly. Then you have the Akin criteria, which was developed by the Acute Kidney Injury Network. Similar to Rifle E, but a bit simpler in terms of staging.
And KDIGO, what's that short for?
That stands for kidney disease, improving global outcomes. Their criteria use changes in both serum creatinine AD urine output over time. Yeah, you're right. They all use similar factors, but each system offers a slightly different perspective.
So it's about having a bunch of tools in the toolbox, essentially, to assess how bad the AKI is and then guide treatment. Now, the chapter gets into the causes of AKI and divides them up into three main groups: pre-renal, intrinsic renal, and post-renal. Could you break those down for us?
Sure. Let's start with pre-renal causes. These are all about problems with the blood flow to the kidneys. It's kind of like a kink in a garden hose. Conditions like really bad dehydration, heart failure, or even sepsis can cut off blood flow to the kidneys, and that leads to AKI.
So the kidneys themselves aren't damaged, they're just not getting what they need to do their job.
Precisely. Now, intrinsic renal causes, these are a bit more complex. They involve damage within the kidney itself, could be glomerulonephritis, which we'll get into later, or acute tubular necrosis, which is where those tiny tubes that filter waste in the kidneys get damaged. Certain medications and toxins can also directly hurt the kidneys.
And postrenal causes, those sound kind of scary, obstructions.
Yeah, postrenal AKI, that's when the urine flow gets blocked somewhere along the way. This could be because of kidney stones, an enlarged prostate in men, or even tumors. Anything that stops the urine from flowing freely can back up into the kidneys and cause problems.
It seems like there's so many things that can go wrong. The textbook gives some examples, case studies with different lab results. How do doctors figure out what's causing AKI in a specific patient?
Urine analysis is a huge help. Looking at what's in the urine gives doctors a lot of clues. For example, in pre-renal AKI, where the problem is blood flow, the urine is usually really concentrated with low sodium because the kidneys are trying to hold on to as much water as possible.
Makes sense. Your body's trying to conserve fluids.
Exactly. But with intrinsic renal AKI, where the kidney itself is damaged, the urine might be diluted with higher sodium because the kidneys can't concentrate the urine properly.
So you can tell a lot from what's in the urine. What about treatment for AKI? Once they know what's causing it, how do they treat it?
The first thing is to treat the underlying cause, whatever's causing the problem. So for pre-renal AKI, that might mean getting fluids back into the body with IV fluids or taking care of whatever's messing with the blood flow. Intrinsic renal AKI treatment might involve medications to control inflammation, keep blood pressure in check, or even remove toxins from the body.
And what about post-renal AKI?
Post-renal, the goal is to get rid of whatever's blocking the urine flow. That could mean putting in a catheter or doing surgery to remove a kidney stone.
In severe cases, dialysis might be necessary, right?
Absolutely. Dialysis can be a lifesaver when the kidneys just can't filter the waste and extra fluid out of the blood. It basically acts like an artificial kidney taking over that job. Now, moving on to chronic kidney disease, or CKD. How's that different from AKI?
Well, AKI seems like it's sudden and potentially reversible, but CKD is like a slow, gradual decline in kidney function that's irreversible, right?
You got it. A key thing to look at with CKD is the glomerular filtration rate, or GFR. It measures how well your kidneys are filtering waste from your blood.
So how do they measure GFR? And what does it mean if your GFR is low?
GFR is calculated using a blood test that measures creatinine, which is a waste product that comes from your muscles. A low GFR means your kidneys aren't filtering as well as they should be. CKD is divided into 5 stages, from stage 1, which is mild damage, to stage 5, which is complete kidney failure.
So the higher the stage, the more damaged the kidneys are.
Right. What's interesting is that you often don't have any symptoms until the later stages of CKD. That's why regular checkups are so important, especially if you have any risk factors. Catching it early makes a huge difference.
Good reminder for all of us listening. What are the most common causes of CKD?
The usual suspects are diabetes and hypertension. Over time, they can damage those tiny blood vessels in your kidneys and affect their ability to filter properly.
The chapter also mentions some genetic conditions like polycystic kidney disease, which we'll talk about more later. But first, tell us a bit about how CKD is managed. It sounds pretty complicated.
It can be. The main goals are to slow down the progression of the disease and prevent complications. Lifestyle changes are a big part of that. Controlling your blood pressure and blood sugar, keeping a healthy weight, and if you smoke, quitting.
And what about medications? What role do they play in managing CKD?
Medications are often used to help manage blood pressure, reduce the amount of protein leaking into the urine, and deal with other complications like anemia or mineral and bone disorders that can come along with CKD. In the later stages, dialysis or a kidney transplant might become necessary.
Okay, let's zoom in a bit now. The chapter goes into the glomeruli, those tiny filters in the kidneys. It talks about glomerulonephritis, or GN, which is an inflammatory condition that can affect kidney function. What can you tell us about that?
GN can be acute or chronic, and it can lead to both AKI and CKD. One important distinction is between focal GN and diffuse GN. Focal GN only affects some of the glomeruli, while diffuse GN affects all of them. This distinction is crucial for the prognosis. Focal GN generally has a better outlook than diffuse GN.
So knowing whether it's focal or diffuse helps doctors understand the potential long-term consequences.
Exactly. The chapter also mentions post-streptococcal glomerulonephritis, or PSGN, which often develops after a strep throat infection. It's a good example of how something that seems like a simple infection can have serious long-term consequences.
So another reminder to take even seemingly simple infections seriously.
Absolutely. And speaking of serious complications, let's talk about nephrotic syndrome. This is where those tiny glomeruli filters become damaged and start leaking protein. A lot of protein.
The textbook mentions edema and potential complications. What does that mean?
Edema, that's basically swelling. You see it a lot in the legs and feet, and it's caused by those low protein levels in the blood. The protein usually helps keep fluid in the blood vessels, but when it leaks out into the urine, fluid starts to build up in the tissues.
So your body has trouble maintaining its fluid balance. What are the other potential complications?
Well, nephrotic syndrome can increase your risk of blood clots, infections, and even malnutrition. And in severe cases, it can contribute to kidney failure.
Now, on to polycystic kidney disease, or PKD. I've seen those pictures of kidneys covered in cysts. It's pretty striking. Can you tell us more about this condition?
Sure. PKD is a genetic disorder that causes all these fluid-filled cysts to grow in the kidneys. Over time, these cysts can really mess with kidney function. There are 2 main types of PKD. Autosomal dominant, or ADPKD, and autosomal recessive, or ARPKD.
So the type of PKD depends on how it's inherited. Can you explain that a bit more?
ADPKD is much more common and usually develops in adulthood. ARPKD, that's much rarer and is usually diagnosed in infancy or childhood.
The textbook mentions that both types can lead to kidney failure, but the outlook is very different depending on the type.
That's right. ADPKD tends to progress very slowly over decades, while ARPKD is much more aggressive. Unfortunately, there's no cure for either type of PKD. The focus is on managing the symptoms, controlling blood pressure, and trying to slow down that kidney damage.
What are some common symptoms of PKD? What might someone experience?
Well, it depends on the type and how severe it is, but back pain, flank pain, headaches, and frequent UTIs are pretty common. As PKD progresses, people might develop high blood pressure, kidney stones, and eventually kidney failure.
Since it's genetic, getting diagnosed early with genetic testing could be really important for family planning.
Definitely. Genetic testing can help people understand their risk of developing PKD or passing it on to their kids. This knowledge can empower them to make informed choices about family planning. Early diagnosis can also lead to better management of symptoms and potentially slow down the progression of the disease.
Now, about those dreaded kidney stones, also called nephrolithiasis, the textbook talks about 4 main types: calcium, uric acid, cysteine, and struvite. Can you walk us through those different types?
Sure, calcium stones are the most common, accounting for about 75% to 85% of all kidney stones. These form when there's too much calcium in the urine, often along with other substances like oxalate or phosphate. Dehydration, a high sodium diet, and even certain medical conditions like hyperparathyroidism can make calcium stones more likely.
So it's not just about how much calcium you eat, but also how your body handles calcium.
That's right. Now, uric acid stones form when there's too much uric acid in the urine. Uric acid is a waste product that comes from breaking down purines, which are found in certain foods.
So what kinds of foods can contribute to uric acid stones?
Foods high in purines, like red meat, organ meats, and shellfish, can increase uric acid levels. Also, medical conditions like gout, diabetes, and obesity can lead to higher uric acid levels in the urine.
What about cystine stones? Those are less common, right?
Yes, cystine stones are the rarest type and are caused by cystinuria. It's a genetic disorder that affects how the kidneys reabsorb cysteine, which is an amino acid. People with cystinuria can't reabsorb cysteine properly, so it builds up in their urine and forms stones.
And last but not least, we have struvite stones. What's interesting about those is that they're actually caused by bacteria, right?
That's right. Certain bacteria that can hang out in the urinary tract produce ammonia, and that contributes to the formation of struvite stones. These stones can get quite large and cause a lot of damage to the kidneys if they aren't treated.
Let's talk about the experience of passing a kidney stone. It's known for being really painful, right?
Oh yeah, the pain can be intense. Imagine a sharp, cramping pain that comes in waves. And where you feel the pain depends on where the stone is stuck. A stone stuck in the upper ureter, for example, might cause pain that radiates to the lower abdomen or groin.
So the pain kind of follows the path of the stone as it tries to work its way out. How are kidney stones diagnosed?
A urinalysis can often provide some clues because blood in the urine is a common finding. Imaging techniques like ultrasounds, x-rays, and CT scans are used to pinpoint the location and size of the stones.
What are the best ways to prevent these kidney stones, and how are they usually treated?
For prevention, dietary changes are often key. For calcium stones, reducing sodium intake and drinking plenty of fluids can help. For uric acid stones, limiting those purine-rich foods like red meat and shellfish is often recommended.
So it's all about understanding what type of stone you're prone to and then making adjustments to your diet to help prevent them from forming.
Exactly. When it comes to treatment, small stones often pass on their own with pain management and increased fluid intake. But for larger or more stubborn stones, medical interventions might be needed.
The textbook mentions something called shockwave lithotripsy. What's that all about?
It's a non-invasive procedure that uses sound waves to break the stones into smaller pieces that can then pass more easily. Other procedures, like ureteroscopy or percutaneous nephrolithotomy, might be necessary for larger or more complex stones.
Medical technology is pretty amazing. Okay, I think we've covered a lot of ground on kidney conditions. Are you ready to move on to some other common urological issues?
Absolutely. Let's dive into the world of UTIs and other conditions that can affect the urinary tract.
UTIs, or urinary tract infections, seem to be incredibly common, especially for women.
They are. UTIs happen when bacteria get into the urinary tract and cause inflammation. Cystitis, which is an infection of the bladder, is the most common type of UTI.
What are the telltale signs that you might have a UTI?
Well, the classic symptoms include frequent urination, a burning sensation during urination, and feeling like you have to urinate urgently, even if only a little comes out. The urine might look cloudy or have a strong odor.
What about pyelonephritis? The textbook mentions that one too.
Pyelonephritis is an infection of the kidneys themselves, and it's usually more severe than cystitis. Symptoms can include fever, chills, back pain, nausea, and vomiting.
So basically a UTI that spread to the kidneys.
You got it. And it needs to be treated quickly with antibiotics to prevent complications like kidney damage.
The textbook also mentions prostatitis and orchitis. Can you break down those terms for us?
Of course. Prostatitis is inflammation of the prostate gland, which is part of the male reproductive system, and orchitis is inflammation of the testicles.
What causes prostatitis and orchitis? Are they related to UTIs?
They can be caused by bacterial infections, sometimes as a complication of a UTI, but they can also be caused by sexually transmitted infections or even autoimmune disorders. Symptoms can include pain in the groin, lower back or abdomen, pain during urination, and fever.
Okay, let's get into some of the male-specific conditions that the chapter mentions. Phimosis, paraphimosis.
Sounds a bit delicate. What are we talking about here?
Phimosis is when the foreskin of the penis is too tight and can't retract over the glands. Paraphimosis is when the force can get stuck behind the glands and can't be pulled back forward.
Ah, okay. Those definitely sound like conditions that would cause discomfort and need medical attention.
Absolutely. Early recognition and treatment are key to preventing complications. The textbook also mentions erectile dysfunction, or ED, hydrocele, spermatocele, and something called testicular torsion. Can you explain those conditions for us?
Sure, let's start with erectile dysfunction, or ED. It's the inability to achieve or maintain an erection that's firm enough for sex. It's actually quite common and can affect men of all ages, though it's more common as men get older.
What causes ED?
The causes of ED are pretty complex and can be both psychological and physical. Psychological causes include stress and anxiety. Physical causes could be heart disease, diabetes, hormonal imbalances, certain medications, smoking, and too much alcohol. Often it's a combination of these factors.
What about hydrocele and spermatocele? What are those?
A hydrocele is a fluid-filled sac that surrounds a testicle, causing swelling in the scrotum. It's usually painless and often goes away on its own. A spermatocele is a cyst that develops in the epididymis, which is that coiled tube that sits on top of each testicle. It's also usually painless and is filled with a milky fluid that may contain sperm.
And then there's testicular torsion. That sounds serious.
It is. Testicular torsion is a true urological emergency. It happens when the spermatic cord, which supplies blood to the testicle, gets twisted and cuts off the blood flow. It's incredibly painful and needs immediate medical attention to save the testicle.
Wow, definitely a reminder to get any unusual pain or swelling down there checked out by a doctor right away. We've covered a lot of conditions that affect men specifically. What about conditions that affect the body's balance of salt and water?
Yes. Let's talk about electrolytes and fluid balance. The textbook mentions hypernatremia and hyponatremia. Can you explain those?
If I remember correctly, hypernatremia is a high sodium level in the blood, and hyponatremia is a low sodium level. I imagine these imbalances can really mess with how our bodies function.
You're right. Sodium is crucial for regulating fluid balance and nerve function. Too much sodium, or hypernatremia, can cause confusion, lethargy, and even seizures. Too little sodium, or hyponatremia, can lead to headaches, nausea, and muscle weakness. In severe cases, both conditions can be life-threatening.
So staying hydrated and keeping your sodium levels balanced is really important for your health.
Absolutely. Now, are you ready to explore some other electrolyte disorders?
Let's do it. The textbook gets into hyperkalemia and hypokalemia, which are about potassium levels. What can you tell us about those?
Potassium is another essential electrolyte. It plays a key role in muscle contractions, nerve impulses, and importantly, heart rhythm. So any imbalance can have a big impact on those systems.
Okay, so let's start with hyperkalemia. What causes potassium levels to get too high?
Kidney disease is the most common cause. When your kidneys aren't working properly, they can't remove excess potassium from your blood effectively.
Are there other things besides kidney disease that can cause hyperkalemia?
Yes, some medications like ACE inhibitors and potassium-sparing diuretics can contribute to high potassium levels. Conditions like adrenal insufficiency can also cause problems regulating potassium. And of course, eating too much potassium can be a factor too, especially if you have kidney problems.
The textbook mentions that hyperkalemia can affect the heart. How does that work?
Well, high potassium levels can mess with the electrical signals that control your heartbeat, and that can lead to arrhythmias or irregular heart rhythms, and that can be very dangerous.
What are some symptoms someone might experience with hyperkalemia?
The symptoms can vary depending on how high the potassium level is. Common symptoms include muscle weakness, fatigue, numbness or tingling, and a slow or irregular heartbeat. In severe cases, it can even lead to cardiac arrest.
That sounds scary. How is hyperkalemia treated?
It depends on what's causing it and how severe it is. In mild cases, making changes to your diet, like cutting back on potassium-rich foods, might be enough. But if it's more severe, you might need medications or even dialysis to lower those potassium levels.
What about hypokalemia, low potassium? What are the common causes of that?
Hypokalemia can happen when your body loses too much potassium, often through things like excessive urination, vomiting, or diarrhea.
So those conditions that cause dehydration, which we talked about earlier, can also lead to low potassium.
Exactly. And some medications, like diuretics, can also contribute to hypokalemia because they make you pee more. Other causes include eating disorders, alcoholism, and some hormonal imbalances, like hyperaldosteronism.
How does having too little potassium affect the body? Are the effects similar to having too much potassium?
In some ways, yes. Like hypokalemia can affect muscle function, nerve impulses, and your heart rhythm. Common symptoms include muscle weakness, fatigue, cramps, constipation, and heart palpitations. In severe cases, it can even lead to arrhythmias and paralysis.
That sounds serious. How is hypokalemia treated?
Treatment usually involves getting those potassium levels back up, either through dietary changes, potassium supplements, or if it's severe, intravenous potassium. And of course, you need to figure out what's causing the hypokalemia in the first place and treat that too to prevent it from happening again.
Okay, let's talk about calcium imbalances now. The textbook goes into hypercalcemia, or high calcium, and hypocalcemia, or low calcium. Can you tell us more about those?
Sure, calcium, as you probably know, is essential for strong bones. But it also plays a role in a lot of other important functions, like muscle contractions, nerve transmission, and blood clotting. When it comes to hypercalcemia, the most common cause is hyperparathyroidism, which is when the parathyroid glands are overactive.
Right. The parathyroid glands are responsible for regulating calcium levels, so if they're producing too much hormone, it can lead to high calcium. Are there other causes of hypercalcemia besides hyperparathyroidism?
Yes, definitely. Certain types of cancer, such as lung, breast, and multiple myeloma, can cause high calcium levels. Excessive vitamin D intake, some medications, and even being immobile for a long time can also contribute to hypercalcemia.
How does hypercalcemia affect the body? What kind of symptoms might you see?
Hypercalcemia can cause a whole range of symptoms. You might experience fatigue, weakness, nausea, vomiting, constipation, kidney stones, or bone pain. In severe cases, you can have confusion, coma, and even heart problems.
That's a lot of potential problems.
Yeah.
How is hypercalcemia treated?
The treatment depends on the cause and how high the calcium level is. It could involve medications, intravenous fluids, or even surgery to remove a parathyroid tumor if that's what's causing the problem.
What about hypocalcemia? What are the common causes of low calcium levels?
Hypocalcemia can happen when you don't have enough calcium in your body or when your body can't absorb the calcium properly. Common causes include hypoparathyroidism, vitamin D deficiency, kidney disease, and some medications like diuretics and bisphosphonates.
What are some of the signs and symptoms of hypocalcemia?
Hypocalcemia can cause muscle cramps, spasms, tingling in your hands and feet, and even seizures in severe cases.
Are there any serious complications associated with hypocalcemia?
If it's severe, it can lead to abnormal heart rhythms, breathing problems, and even coma. So, just like with hypercalcemia, it's important to catch it early and treat it.
How is hypocalcemia treated?
Treatment typically involves calcium supplements, vitamin D supplements, and of course, addressing the underlying cause. If it's really severe, you might need intravenous calcium to get those levels up quickly. It's thought to be related to genetic mutations that happen sometime during fetal development.
And how is it usually treated?
Treatment usually involves surgery to remove the tumor and then chemotherapy, and sometimes radiation therapy is used as well.
Okay, so we've talked about several different types of cancer that can affect the urinary tract and the male reproductive system. Now let's get back to those conditions that affect the foreskin. The chapter mentions phimosis and paraphimosis. Can you explain those a little bit?
Those conditions are specific to males who haven't been circumcised. They involve the foreskin, that's the skin that covers the head of the penis. Phimosis is when the foreskin is too tight to be pulled back over the head of the penis, over the glands. And paraphimosis is when the foreskin gets stuck behind the glands and can't be pulled back forward. That can actually lead to some serious complications.
So phimosis is kind of like having a tight-fitting sleeve, and paraphimosis is like getting that sleeve stuck behind the head of the penis.
That's a great way to think about it. And just like a stuck sleeve can cut off circulation, paraphimosis can restrict blood flow to the glans penis, making it a real urological emergency.
Oh, wow. So what causes these conditions?
Phimosis can be something someone is born with, or it can develop later because of infections, inflammation, or scarring. Paraphimosis usually happens if the foreskin is retracted for cleaning or a medical exam and it isn't put back in its normal position.
What kind of symptoms would someone experience with these conditions?
With phimosis, someone might have difficulty urinating, they might have pain when they get an erection or recurring infections. With paraphimosis, the glans penis will be swollen and painful, and there'll be a tight band of foreskin behind it.
And how are they treated?
Treatment for phimosis kind of depends on how severe it is. It could be something as simple as using topical steroid creams to help stretch the foreskin, or in more serious cases, circumcision might be necessary. Paraphimosis, on the other hand, needs immediate medical attention to manually reduce the foreskin and get that blood flowing again.
Speaking of conditions that need medical attention, the chapter also talks about varicocele. What exactly is that?
A varicocele is basically an enlargement of the veins in the scrotum. specifically in the pampiniform plexus, which is a network of veins that drain the testicles. Think of it like varicose veins, but in your scrotum.
Ouch, that doesn't sound pleasant. Is it painful?
It often feels like a heaviness or a bag of worms in the scrotum. It's usually not painful, but it can cause some discomfort, especially after standing for a long time or after physical activity.
What causes varicose leaks?
The exact cause isn't always clear, but it's thought to be related to problems with the valves in the veins, which normally prevent blood from flowing backward. When those valves don't work properly, the blood pools in the veins, and they become enlarged.
Are there any complications associated with varicocele?
Sometimes a varicocele can affect sperm production and lead to infertility. That's why it's important to get checked out by a doctor if you notice any swelling or discomfort in your scrotum.
So how are they treated?
If a varicocele is causing pain, discomfort, or affecting fertility, there's a surgical procedure called a varicocelectomy. It involves tying off the affected veins and redirecting the blood flow.
Okay, so now let's get back to those disorders of salt and water balance. Earlier, we talked about hypernatremia and hyponatremia, which are high and low sodium levels in the blood. Can you remind us what causes those conditions?
Sure. Hypernatremia, high sodium, can be caused by not drinking enough fluids, especially when it's hot out or you're sweating a lot from exercise. It can also happen if you lose too much fluid, for example, from severe diarrhea, burns, or some kidney problems.
So dehydration can really throw off that sodium balance.
Exactly. And hyponatremia, low sodium, that can happen for a few reasons. It could be from drinking too much water, using certain medications like diuretics, or having conditions like heart failure, liver disease, or some hormonal imbalances.
It seems like the key takeaway here is that maintaining that balance of fluids and electrolytes in your body is really crucial for your overall health.
Exactly. Those imbalances can really affect how your body functions, especially your brain.
Okay, let's move on to another set of electrolyte disorders. Potassium imbalances. Can you tell us more about those?
Potassium is a really important electrolyte. It plays a role in muscle contractions, nerve impulses, and probably most importantly, heart rhythm. So any imbalance in your potassium levels can cause problems.
The chapter talks about both hyperkalemia, which is high potassium, and hypokalemia, which is low potassium. Let's start with hyperkalemia. What are the common causes of having too much potassium in your blood?
Kidney disease is a big one. If your kidneys aren't working the way they should, they have a hard time getting rid of excess potassium, but there are other things that can cause it too.
What are some of those other causes?
Certain medications, like ACE inhibitors and potassium-sparing diuretics, can contribute to hyperkalemia. Then there are conditions like adrenal insufficiency, where the adrenal glands aren't producing enough hormones, and that can mess with potassium regulation as well. And of course, eating a diet that's really high in potassium can be a factor, especially if you already have kidney problems.
How does having too much potassium affect the heart?
Well, high potassium levels can interfere with the electrical signals that control your heartbeat. And that can lead to arrhythmias, which are irregular heartbeats. That can be pretty dangerous.
What are some signs that someone might have hyperkalemia?
The symptoms can vary depending on how high the potassium level is. Some common symptoms include muscle weakness, fatigue, numbness or tingling, and a slow or irregular heartbeat. In severe cases, hyperkalemia can even lead to cardiac arrest.
That sounds pretty serious. How is hyperkalemia treated?
The treatment depends on the cause and how severe it is. Sometimes making changes to your diet, like limiting potassium-rich foods, can be enough. But in more serious cases, you might need medications or even dialysis to get those potassium levels back to normal.
What about hypokalemia, which is when your potassium levels are too low? What are some common causes of that?
Hypokalemia often happens when you lose too much potassium, usually through things like excessive urination, vomiting, or diarrhea.
So those conditions that cause dehydration can also contribute to low potassium.
You got it. And certain medications, like diuretics, can also lead to hypokalemia because they make you pee more. Other causes include eating disorders, alcoholism, and some hormonal disorders like hyperaldosteronism.
What happens when your potassium level is too low?
Hypokalemia can affect your muscles, your nerves, and your heart, just like hyperkalemia. Some common symptoms include muscle weakness, fatigue, muscle cramps, constipation, and heart palpitations. In severe cases, it can lead to arrhythmias and even paralysis.
Wow, that's serious. How is hypokalemia treated?
The goal of treatment is to get your potassium levels back up to normal. This can be done through dietary changes, potassium supplements, or, in severe cases, through intravenous potassium. It's also important to find out what's causing the hypokalemia in the first place and treat that as well so it doesn't happen again.
Okay, let's move on to calcium imbalances. The textbook talks about hypercalcemia, which is high calcium, and hypocalcemia, which is low calcium. What should we know about those?
Calcium is a mineral that's crucial for strong bones, but it also plays a role in muscle function, nerve transmission, and blood clotting. When it comes to hypercalcemia, the most common cause is hyperparathyroidism. That's a condition where the parathyroid glands, which regulate calcium levels, become overactive.
Right, so if the parathyroid glands are producing too much hormone, that can lead to high calcium levels. Are there other things that can cause hypercalcemia besides hyperparathyroidism?
Yeah, there are a few other things. Certain types of cancer, like lung, breast, and multiple myeloma, can cause hypercalcemia. Taking too much vitamin D, some medications, and even being immobile for a long time can all contribute to high calcium levels.
What are the effects of having too much calcium in your blood?
Hypercalcemia can cause a bunch of different symptoms. You might experience fatigue, weakness, nausea, vomiting, constipation, kidney stones, or bone pain. In more severe cases, it can lead to confusion, coma, and even heart problems.
That's a lot to be concerned about.
Yeah.
How is hypercalcemia treated?
The treatment really depends on what's causing it and how high the calcium level is. It might involve medications, intravenous fluids, or even surgery to remove a parathyroid tumor if that's the underlying cause.
What about hypocalcemia, low calcium? What causes that?
Hypocalcemia can happen when you don't have enough calcium in your body or when your body can't absorb calcium properly. Common causes include hypoparathyroidism, vitamin D deficiency, kidney disease, and some medications like diuretics and bisphosphonates.
So how does having too little calcium out the body?
Hypocalcemia can cause a variety of symptoms like muscle cramps, spasms, tingling in your hands and feet, and even seizures if it's severe.
Are there any serious complications associated with hypocalcemia?
In severe cases, yeah, it can lead to abnormal heart rhythms, breathing problems, and even coma. Just like hypercalcemia, it's important to get it diagnosed and treated promptly.
How is hypocalcemia treated?
Treatment usually involves calcium supplements, vitamin D supplements, and of course, addressing the underlying cause to try to prevent it from happening again. In severe cases, you might need intravenous calcium to quickly get those levels back up.
So we've covered a lot in this deep dive. We've talked about all kinds of conditions that affect the kidneys and urinary system, from acute and chronic kidney disease to kidney stones and other urological conditions.
We also looked at how important it is to keep those fluids and electrolytes balanced in your body, and we went over the causes, symptoms, and treatments for different types of electrolyte disorders.
And we talked about various types of cancer that can affect the urinary tract and the male reproductive system. It's clear that early detection and treatment are really crucial for these types of cancers.
It's been a very thorough look at this chapter, but keep in mind this is just the tip of the iceberg. There's so much more to learn about these topics, and we encourage you to keep exploring.
I totally agree. We hope this deep dive has given you a good understanding of these really important aspects of your health. Now, are you ready to tackle the last part of the chapter, which focuses on some final details about those common urological conditions?
Let's do it. We've covered the basics, so now we can dive into some of the specifics.
Okay, let's revisit UTIs for a moment. We talked about the different types and causes, but can you remind us of those classic signs and symptoms that could indicate someone has a UTI?
Sure. The most common signs of a UTI involve changes in urination. You might feel a burning sensation when you pee. You might feel like you constantly have to go to the bathroom, even if just a little comes out. And sometimes you might have pain in your lower abdomen.
And what about the urine itself? Are there any changes in the urine that might be a sign of a UTI?
Yeah, the urine might look cloudy or have a really strong or foul odor.
So if someone has those kinds of symptoms, it's important to see a doctor to get checked out.
Absolutely. Early diagnosis and treatment are really important for preventing more serious complications.
We talked about how antibiotics are usually the go-to treatment for UTIs. Are there things people can do to help prevent UTIs in the first place?
Definitely. Staying hydrated is really important because it helps flush bacteria out of your urinary tract. Wiping from front to back after using the toilet is also crucial for preventing the spread of bacteria from the rectal area to the urethra.
What about cranberry juice? I've heard that can help prevent UTIs. Is there any truth to that?
There's some research that suggests cranberries might help prevent UTIs, but it's not conclusive. It definitely shouldn't be considered a replacement for antibiotics if you actually have a UTI. It's always best to consult with a doctor for proper diagnosis and treatment.
Okay, let's talk about prostatitis for a minute. Can you remind us what prostatitis is and what causes it?
Prostatitis is inflammation of the prostate gland, which is that walnut-shaped gland that sits just below the bladder in men. It can be caused by bacterial infections, nerve damage, irritation, or even autoimmune disorders.
What are the typical symptoms of prostatitis?
Well, the symptoms can vary depending on the cause, but often they include those UTI-like symptoms that we talked about earlier, like frequent urination, urgency, and burning or pain during urination. You might also experience pain in your lower back, groin, or abdomen.
And how is prostatitis usually treated?
The treatment really depends on the underlying cause. If it's a bacterial infection, then antibiotics are usually prescribed. For other types of prostatitis, treatment might include pain relievers, muscle relaxants, or even surgery in some cases.
What about orchitis? Can you give us a quick overview of that condition?
Orchitis is inflammation of the testicles. It's often caused by viral infections, particularly mumps. It's actually a well-known complication of mumps in adult males. But it can also be caused by bacterial infections, sometimes as a complication of a UTI or epididymitis.
What are the most common symptoms of orchitis?
The most common symptom is pain and swelling in the affected testicle, usually on one side. You might also experience fever, chills, nausea, and vomiting.
And how is orchitis treated?
Just like prostatitis, the treatment for orchitis really depends on the underlying cause. If it's viral, like with mumps, supportive care is usually all that's needed, including things like pain relievers and rest. But if it's caused by a bacterial infection, then antibiotics are needed to clear it up.
Okay, now let's move on to benign prostatic hyperplasia, or BPH. Can you remind us what BPH is and what causes it?
BPH is when the prostate gland gets bigger, but it's not cancerous. It's extremely common in older men. More than half of men over the age of 50 will experience BPH at some point.
So it's not cancer, but it can still cause problems.
Absolutely. As the prostate enlarges, it can press on the urethra, which is that tube that carries urine out of the bladder, and that pressure can cause a whole host of urinary symptoms.
What are some of the most common symptoms associated with BPH?
Symptoms can vary, but they usually involve difficulty urinating. You might have a weak or intermittent urine stream, have to strain to pee, feel like your bladder isn't completely empty, or experience dribbling after you finish urinating. Having to urinate frequently, especially at night, is another really common symptom.
And what are the typical treatments for BPH?
The treatment depends on how bad the symptoms are. Sometimes simple lifestyle changes can help, like reducing fluids in the evening, but for more troublesome symptoms, medications or even surgery might be needed.
Earlier, we talked about prostate cancer, which is a much more serious condition. Could you remind us about prostate cancer and its symptoms?
Sure. Prostate cancer is the most common cancer in men, but the good news is that it's often slow-growing and very treatable, especially if it's caught early.
What are the symptoms of prostate cancer?
One of the tricky things about prostate cancer is that it often doesn't cause any noticeable symptoms in its early stages. But as it progresses, it can cause urinary problems similar to those we talked about with BPH, as well as pain in the bones, fatigue, and unexplained weight loss.
So it's really important to be aware of any changes in your urinary habits and to talk to your doctor if you notice anything unusual.
Absolutely. Early detection is really key when it comes to successfully treating prostate cancer.
Okay, now let's talk about bladder cancer. What is bladder cancer exactly?
Bladder cancer is a type of cancer that starts in the bladder, the organ that stores urine. It's the 4th most common cancer in men and the 9th most common in women.
What are the symptoms of bladder cancer? Do they overlap with symptoms of other conditions we've talked about?
Yeah, they can. The most common symptom of bladder cancer is hematuria, which means blood in the urine. You might also have pain or burning when you pee, feel like you need to pee frequently, and have that feeling of urgency to urinate even when your bladder isn't full. These symptoms can also be signs of UTIs or other conditions, so it's important to see a doctor if you have any new or concerning urinary symptoms that don't clear up quickly.
What causes bladder cancer?
The exact cause of bladder cancer isn't really known, but smoking is a huge risk factor. In fact, smoking is thought to be responsible for about half of all bladder cancer cases. Other risk factors include exposure to certain chemicals, chronic bladder infections, and a family history of bladder cancer.
So how is bladder cancer treated?
The treatment for bladder cancer depends on the stage and grade of the cancer. It might involve surgery, chemotherapy, radiation therapy, or a combination of those approaches.
The chapter also talks about renal cell carcinoma, or RCC, which is a type of kidney cancer. Can you tell us about that?
Sure. RCC is the most common type of kidney cancer. It accounts for about 90% of all kidney cancer cases. It develops in the lining of those tiny tubes in the kidneys that filter waste from the blood.
What are the symptoms of RCC?
RCC is another one of those cancers that can be tricky because it often doesn't cause any noticeable symptoms in the early stages. But as the tumor grows, it can cause blood in the urine, pain in your side or flank, a lump that you can feel in your abdomen, fatigue, and unexplained weight loss.
What are the risk factors for RCC?
The exact cause of RCC isn't known, but smoking is definitely a big risk factor, as is a family history of RCC. Other risk factors include high blood pressure, obesity, and exposure to certain industrial chemicals.
And how is RCC typically treated?
Like many cancers, the treatment for RCC depends on the stage of the cancer. It might involve surgery to remove part or all of the affected kidney, radiation therapy, chemotherapy, or immunotherapy, which uses your body's own immune system to help fight the cancer.
We also talked briefly about Wilms's tumor earlier, which is a type of kidney cancer that affects children. Can you remind us about that?
Sure. Wilms tumor, which is also known as nephroblastoma, is the most common type of kidney cancer in kids, and it usually develops before the age of 5.
What are the signs and symptoms of Wilms tumor?
The most common symptom is a lump in the abdomen. Parents might also notice abdominal swelling, pain, fever, blood in the urine, and high blood pressure.
And what causes Wilms tumor?
The exact cause isn't really known, but it's thought to be related to genetic changes, mutations that occur during fetal development.
So how is Wilms tumor treated?
Treatment usually involves surgery to remove the tumor, and then chemotherapy, and sometimes they use radiation therapy too.
Okay, so we've covered a lot of different types of cancer that can affect the urinary system and the male reproductive system. Now let's shift gears back to those electrolyte disorders. Earlier, we talked about hypernatremia and hyponatremia, high and low sodium levels. Can you give us a quick refresher on what causes those conditions?
Of course. Hypernatremia, which is high sodium, can be caused by a few things. Sometimes it's just from not drinking enough fluids, especially in hot weather or when you're exercising and sweating a lot. It can also be from losing too much fluid through things like severe diarrhea, burns, or certain kidney problems.
So dehydration can really throw off your sodium balance.
Right. And hyponatremia, which is low sodium, can happen for several reasons too. It could be from drinking too much water, certain medications like diuretics, or conditions like heart failure, liver disease, or hormonal problems.
It seems like the main takeaway here is that keeping those fluids and electrolytes in balance is incredibly important for our overall health.
You're absolutely right. These imbalances can really affect how your body works, especially your brain.
Now let's move on to potassium imbalances. We talked about hyperkalemia and hypokalemia earlier, which are high and low potassium levels. Can you remind us what causes these conditions?
Potassium is another one of those super important electrolytes that our bodies need to function properly. It's especially important for things like muscle contractions, nerve impulses, and making sure our hearts are beating properly. Anytime those potassium levels get out of whack, it can cause problems.
So let's start with hyperkalemia, which is high potassium. What causes potassium levels to get too high?
Kidney disease is one of the most common causes. When the kidneys aren't working the way they should, they have a hard time getting rid of the extra potassium. But there are other things that can cause it too.
Like what?
Some medications, like ACE inhibitors and potassium-sparing diuretics, can contribute to high potassium. Conditions like adrenal insufficiency can also mess with potassium regulation. And of course, just eating a diet that's really high in potassium can be a factor, especially if you already have kidney problems.
Then how does hyperkalemia affect the heart?
Having too much potassium can disrupt the electrical signals that control your heartbeat, which can lead to arrhythmias or irregular heartbeats. That can be dangerous.
What are some signs that someone might have hyperkalemia?
The symptoms can vary depending on how high the potassium is, but some common symptoms include muscle weakness, fatigue, numbness or tingling, and a slow or irregular heartbeat. In severe cases, hyperkalemia can even lead to cardiac arrest.
That's scary. How is hyperkalemia treated?
It really depends on what's causing it and how severe it is. Sometimes making dietary changes can be enough, like cutting back on potassium-rich foods. But in more serious cases, you might need medication or even dialysis to get those potassium levels back to normal.
Okay, what about hypokalemia, which is low potassium? What are the common causes of that?
Hypokalemia usually happens when your body loses too much potassium. This can happen through excessive urination, vomiting, or diarrhea.
So those conditions that cause dehydration can also contribute to low potassium.
Exactly. And certain medications, like diuretics, can also contribute to hypokalemia because they make you pee more. Other causes include eating disorders, alcoholism, and certain hormonal imbalances like hyperaldosteronism.
So what happens when your potassium level is too low? What kinds of symptoms would you see?
Hypokalemia can affect your muscles, nerves, and heart, just like hyperkalemia can. Common symptoms include muscle weakness, fatigue, muscle cramps, constipation, and heart palpitations. And in severe cases, it can lead to abnormal heart rhythms and even paralysis.
That's a lot to be concerned about. How is hypokalemia treated?
The goal of treatment is to get your potassium levels back up to normal. This can often be done through dietary changes, taking potassium supplements, or, in severe cases, receiving intravenous potassium. It's also important to address whatever's causing the hypokalemia in the first place so it doesn't keep happening.
Okay, let's switch gears and talk about calcium imbalances. The chapter covers both hypercalcemia and hypocalcemia, which are high calcium and low calcium. What do we need to know about those conditions?
Well, as you know, calcium is really important for building and maintaining strong bones, but it's also essential for a lot of other things like muscle function, nerve transmission, and making sure your blood clots properly. When it comes to hypercalcemia, the most common cause is hyperparathyroidism. That's a condition where the parathyroid glands, which regulate your calcium levels, become overactive.
Right, so if the parathyroid glands are making too much hormone, it can lead to high calcium levels.
Oh.
Are there other causes of hypercalcemia besides hyperparathyroidism?
Yes, definitely. Certain types of cancer can cause hypercalcemia, especially lung cancer, breast cancer, and multiple myeloma. Taking in too much vitamin D, some medications, and even being immobile for a long time can also cause high calcium levels.
What are the effects of hypercalcemia? How does it affect the body?
Hypercalcemia can cause a really wide range of symptoms. You might feel fatigued and weak or have nausea, vomiting, constipation, kidney stones, or bone pain. If it's really severe, you can have confusion, coma, and even heart problems.
Wow, those are some serious complications. How do you treat hypercalcemia?
It really depends on what's causing it and how high the calcium level is. Treatment might involve medications, intravenous fluids, or even surgery to remove a parathyroid tumor if that's the underlying problem.
Okay, now what about hypocalcemia, which is low calcium? What causes that?
Hypocalcemia can happen when you just don't have enough calcium in your body or when your body can't absorb the calcium properly. Some common causes include hypoparathyroidism, vitamin D deficiency, kidney disease, and some medications like diuretics and bisphosphonates, which are often used to treat osteoporosis.
So what happens to your body when you have too little calcium? What kinds of symptoms might you see?
Hypocalcemia can cause muscle cramps, spasms, tingling in your hands and feet, and even seizures if it's severe.
Are there any long-term or serious problems that can happen with hypocalcemia?
Yes, if it's severe and not treated, it can lead to problems with your heart rhythm, breathing problems, and even coma. So just like with hypercalcemia, it's important to catch it early and get it treated.
How do you treat hypocalcemia?
Usually treatment involves taking calcium supplements and vitamin D supplements, and also figuring out what's causing the hypocalcemia and addressing that underlying problem. In severe cases, you might need intravenous calcium to quickly get those levels back up. Well, prostate cancer is often silent in the early stages. You don't really notice any symptoms. But as it grows, it can cause those urinary problems, a lot like we talked about with BPH, and you might see things like bone pain, fatigue, and losing weight without trying.
So it's always a good idea to talk to your doctor if you notice any changes in your bathroom habits or if you have any other symptoms that are worrisome.
Definitely, early detection is so important for successful treatment.
Okay, let's move on to bladder cancer. What are the typical symptoms?
The most common one is hematuria, which is blood in the urine. You might also feel pain when you pee, feel like you need to go all the time, and have that sense of urgency even if your bladder isn't full.
Those sound a lot like the UTI symptoms. How can you tell the difference?
You're right, they can overlap. That's why it's super important to see a doctor for any urinary symptoms that are new or if they're worrisome or they just don't go away. Your doctor can do some tests to figure out what's really going on.
What are some of the things that cause bladder cancer?
The exact cause is still a mystery, but smoking is a huge risk factor. About half of all bladder cancer cases are thought to be caused by smoking. Other things that increase the risk include exposure to certain chemicals, having chronic bladder infections, and a family history of bladder cancer.
How is bladder cancer treated?
It depends, really, on the stage and grade of the cancer. Treatment could include surgery, chemotherapy, radiation therapy, or a combination of those.
The chapter also talks about renal cell carcinoma, or RCC. Remind us what that is again.
RCC is the most common type of kidney cancer. About 90% of kidney cancers are RCCs, It starts in the lining of those little tubes in the kidneys, the ones that filter the waste products out of your blood.
What are the symptoms of RCC?
RCC is kind of sneaky because it often doesn't cause any noticeable symptoms early on. But as the tumor grows, you might start to see blood in your urine, feel pain in your side or flank, have a lump you can feel in your abdomen, feel tired all the time, or lose weight for no apparent reason.
What causes RCC?
No one knows for sure what the exact cause is, but smoking is a big risk factor, and so is a family history of RCC. Other things that might increase your risk include high blood pressure, obesity, and being exposed to certain industrial chemicals.
And how is it usually treated?
The treatment really depends on the stage of the cancer. It could involve surgery to remove part or all of the kidney, radiation therapy, chemotherapy, or immunotherapy, which harnesses your body's own immune system to fight the cancer.
Earlier, we briefly talked about Wilms tumor, which is a type of kidney cancer that affects children. Can you refresh our memory on that one?
Sure. Wilms's tumor, which also goes by the name nephroblastoma, is the most common type of kidney cancer in kids. It usually shows up before the age of 5.
What are the symptoms?
The most common symptom is finding a lump in the child's abdomen. Parents might also notice things like abdominal swelling, pain, fever, blood in the urine, or even high blood pressure.
What causes Wilms's tumor?
The exact cause isn't clear, but researchers think it's related to genetic mutations that happen during fetal development.
How is it treated?
Treatment usually involves surgery to remove the tumor, followed by chemotherapy, and sometimes they use radiation therapy too.
Wow, we've covered so much ground in this deep dive. It's amazing how complex our bodies are. And it's so important to understand how all these systems work together to keep us healthy.
I agree. The human body is an amazing thing, that's for sure.
This deep dive has given us a much better understanding of the kidneys and everything below the belt. We learned about the different types of kidney disease, those painful kidney stones, and all sorts of urological conditions. And we can't forget about those electrolytes. Keeping them balanced is so important for so many bodily functions.
It's all connected, that's for sure.
We also learned about the different types of cancers that can affect the urinary system and the male reproductive system. And I think it's really clear that catching these cancers early is really important for successful treatment.
Absolutely. Early detection can make a huge difference.
Well, that wraps up this deep dive. Remember, this was just a starting point. There's so much more to learn, and we encourage you to keep learning about your health and asking questions.
And don't hesitate to talk to your doctor. They can give you personalized advice and answer any specific questions you might have.
Thanks for joining us on this fascinating journey through the world of nephrology and urology. Until next time, stay curious and stay healthy.